Hello everyone, welcome back to the channel. A few weeks ago, I made a video explaining why if you are on a statin medication, you may be recommended to take a coenzyme Q10 supplement. Click here to watch that in case you missed it. In that video, I briefly touched on how statins work, but statins are the most commonly prescribed medication around the world. About 25% of Americans above 45 years old are taking a statin, so I feel like that warrants an entire video being dedicated to these medications, because if you are taking a statin, you should know how exactly it is working to help reduce your cholesterol. So today, I'll be going through exactly how they work and why they protect your heart, as well as addressing some common concerns about statins. So let's get into it. If you didn't already know, statin medications are used to help reduce cholesterol levels. And I've discussed cholesterol a few times on the channel already, but cholesterol isn't this purely evil substance that needs to be avoided at all costs. You do need it. Your cells need it to help maintain their structure. Without it, they would collapse, as cholesterol is needed to make cell walls. You need cholesterol to also help make hormones and vitamin D. But like all things, if you have too much, it can become a problem. And when it comes to cholesterol, we hear about LDL and HDL. HDL is known as high density lipoprotein, and people call it the good cholesterol because it's sort of like the cleaning crew. It removes cholesterol from the bloodstream and takes it to the liver, where it's used for making things like hormones or just removed from your body entirely. And this is great because it prevents cholesterol building up in arteries. Now, LDL, also known as low density lipoprotein, is the bad cholesterol because it takes cholesterol from the liver to your bloodstream, and if there is too much of it around, the cholesterol will build up on your artery walls. And these buildups can cause blockages in the arteries that will reduce blood flow and make it harder for blood to travel to your heart and other organs. And this is why we want to keep cholesterol levels low, because these buildups can lead to some serious issues. For example, the buildups can burst and lead to complete blockages. This starves your heart of oxygen, and when that happens, it can lead to a heart attack. If the blockage leads to reduced blood flow to the brain, then this can cause a stroke. So as you can see, the situation can get quite bad. And that is where statins come in, because they can help to reduce those LDL levels. So how do they work? Before you understand how statins work, you actually need to understand how cholesterol gets made in your body. So this is the pathway that takes place to make cholesterol in the body. And this process happens inside your liver. So as you can see, you start with something called acetyl-CoA, which is a byproduct of carbohydrate and fat breakdown. Now, a very important enzyme is needed in this first step, and this enzyme is called HMG-CoA reductase. It takes your acetyl-CoA and it turns it into something called HMG-CoA. And then a few more reactions take place until eventually you get the end product, which is cholesterol. Now, you do need other things like amino acids and some vitamins to help get to this end step, but this is just the basics that you need to know for now. Once you have the cholesterol, it gets packaged up and taken away. And one of the things it gets packaged up into is, of course, LDL, which then takes it to the blood vessels. Now, statins, they actually interfere with this process here. They inhibit the main enzyme that I mentioned earlier, this HMG-CoA reductase. Statins will bind to this enzyme and block its activity, which means that this first step of the pathway can't actually happen. And then the entire process gets blocked, which means the end product, the cholesterol, can't be made. Now, in the end, this will slow down how much cholesterol is being made in the liver. And since less cholesterol is being pumped out, your liver also makes less LDL because it doesn't need to transport as much cholesterol around the body. And this means overall, your LDL levels in your bloodstream will decrease. Now, statins have been around for a very long time, since the 80s, and that means we have had a lot of time to research how effective they are, and they are really good at reducing cholesterol levels, particularly your LDL levels. Research has shown that statins can reduce LDL levels by about 30%, and in some cases even up to 50%. By reducing LDL levels so well, they can actually reduce the risk of people experiencing cardiovascular events, so things like heart attacks and strokes. And so the benefits with these medications are quite clear. Now, as we know, with cholesterol, there are two players, the LDL and the HDL. And while statins are great for lowering LDL, their effect on HDL isn't quite as good. They have been found to increase HDL levels, which we want, but only by about 5 to 10%. So there's a little benefit, but the main reason statins are beneficial is because of how much they reduce LDL cholesterol levels. So now we know how statins do their job. I want to quickly talk about side effects. The majority of people taking statins don't really experience side effects, but the most common side effect is actually muscle aches and pains, usually in the legs. And about 10% of people taking statins might experience this, as well as some fatigue. One of the reasons that this happens is because statins also block the production of CoQ10 or coenzyme Q10 in the body. And CoQ10 is important for energy production. Now, I have a whole video talking about this, so click here to go see that. Now, in very rare cases, about 0.1% of people taking statins, this muscle pain becomes quite severe, and it's actually a condition called rhabdomyolysis, where muscle tissue actually breaks down. And if muscle breaks down, the byproducts released into the blood can be quite harmful and cause things like kidney damage. So this is really rare, but it's important that if muscle aches get severe, that you stop taking the medication and go see a doctor. Now, the final thing I just want to finish on is going through the different types of statins. There are a few types that belong to this class, and while they all work the same way, some are stronger than others. So here is a chart, and as you can see, it's rosuvastatin or Crestor that's the strongest, followed by atorvastatin, also known as Lipitor. Your cholesterol levels and how high your cardiovascular risk is will determine which of these you are prescribed and which dose you need. For example, if you have just had a heart attack, you have a very high cardiovascular risk, and it's usually aggressive treatment, so you will be put on a strong statin with a high dose because preventing another heart attack is the priority. So that's how statins work, and hopefully it has given you some understanding. I always think if you're putting something in your body, you need to know what it's doing to you and how it's doing that to you. So as with all medications that are used to treat chronic health conditions, you will get the most out of them if you also make changes to your diet and physical activity levels. Now, if you have any questions, please comment below, and if you learned something or enjoyed the video, don't forget to subscribe and give a like. Have a great week. I will see you in the next video, and until then, keep playing the long game.